Hi, Mark. My name is Jessica. I'm going to be the student nurse practitioner that's working with you today. How are you?
Doing good.
So what we're going to be doing today is a full head-to-toe assessment. I'll walk you through everything as we're going, but first let me just wash my hands before we start. Okay. Do you have any concerns today?
Feel okay?
Okay, perfect. So what I'm going to do first is we're going to start with a neurological assessment. I'm just going to ask you a few questions. Can you just tell me your full name and your birthday?
Mark Reicher, April 23rd, 1987.
Okay, and what is the year?
Current year, 2022.
Okay, and where are you right now?
At home.
Okay, and what are we doing?
We're doing a physical assessment.
Okay, perfect. So you're alert and oriented. What I'm going to have you do is I'm going to have you follow some simple commands for me. Can you close your eyes? Open your eyes. Close your eyes and open your mouth. You can open your eyes again. So close your eyes, open your mouth, and put your arms up in the air. Okay, perfect. So you're able to follow some simple commands for me. Next, I'm just going to have you repeat some words for me. Can you say dog?
Dog.
Cat?
Cat.
Liquid electricity?
Liquid electricity.
No ifs, ands, or buts.
No ifs, ands, or buts.
Okay, perfect. So what I'm going to have you do next is I'm going to have you repeat a couple words for me, and then later on in the exam, I'm going to have you try and repeat those same words, okay? Green leaf.
Green leaf.
Pink flower.
Pink flower.
The Statue of Liberty.
Statue of Liberty.
Okay, perfect. So I'm going to have you try and remember those, and we'll ask you to repeat them at the end of the exam. Okay, so I'm going to have you just read this piece of paper for me and do the action.
Out loud?
Yes.
Raise your right hand.
Okay, perfect. And next, I'm going to have you, on that same piece of paper, just go ahead and write a full sentence for me. Okay, I'm having a good day. Very good. All right, so what we're going to move on to next is we're going to do an evaluation of your cranial nerves. So we'll start with cranial nerve 1. What I'm going to have you do is just close your eyes for me and tell me what you smell.
Smells like an orange.
Okay, perfect. Very good. Next, we're going to move on to cranial nerve 2. So what I'm going to have you do is you're going to focus on me. I'm going to cover this eye, and can you see my whole face?
Yeah.
Okay, perfect. I'm going to stick up some numbers on sides, and you're going to let me know if you see what number you see, okay?
1, 2, 2, 1, 3.
Okay, let's do the same on the other side. You can see my whole face?
Yeah.
Okay.
1, 2, 2, 2, 3.
Okay, very good. So next what we're going to be doing is testing your cranial nerves 3, 4, and 6. So I'm just checking your pupillary response, and I'm also checking your eye movements, checking for any double vision, irregular eye movements called nystagmus. So first, I'm going to just check your pupillary response. So just focus on an object straight ahead. Okay. Just checking both eyes here. Okay, very good. So next I'm just going to have you follow my finger. All right, checking for accommodation. Okay, very good. So then next what we're going to be doing is checking cranial nerve 5. So what I'm going to have you do is I'm going to have you close your eyes, and I'm just going to touch a soft object to your face, and you're going to let me know, just say yes when you feel the object on your face, okay?
Yes. 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 Yes.
Okay, very good. Okay, you can go ahead and open your eyes. So next what we're going to be doing is we're going to check cranial nerve 7. So what I'm going to have you do for me is just smile real big, frown, make a kissy face, wrinkle your forehead. Okay, very good. So that's just testing some facial symmetry. Next, what we're going to do is a cranial nerve 8. We're going to check your hearing. So what I'm going to do is a Weber and a Rhine test. So what I'm going to do first is the Rhine test. I'm going to just hit my tuning fork, and you're going to let me know whether you hear the sound in, I'm going to say 1 or 2, and you're going to let me know which sound is louder, okay?
Okay.
1 or 2?
1.
Do the same on the other side. 1 or 2?
1.
Okay, very good. So next what I'm going to do is a Weber test. What we're going to do is we're going to put the tuning fork on the center of your forehead, and you're going to let me know if you hear the sound evenly on both sides, okay?
Even, yeah.
Okay. Okay. Next we're going to do cranial nerves 9 and 10. What I'm going to have you do is just stick your tongue out for me and say ah. Okay, perfect. So the uvula is midline center with the soft palate moving normally. And then we're going to check cranial nerve 11 next. I'm going to just have you shrug your shoulders and kind of try to push down and then turn your head that way to the left and then push against my hand. Same on the other side. Turn that way. Push again. Okay, very good. And then the last one, cranial nerve 12, I'm going to have you just stick your tongue out for me. Okay, perfect. And I was just looking for any abnormal, like a weakness or anything on, everything looks normal there.
Okay.
Okay, so next what we're going to do is we're going to check your strength. So what I'm going to have you do is just kind of put your arms out like this. And you're going to try and push my arms in. And same thing, go push out. Okay, very good. Can you go ahead and put your arms out like this for me? I'm just checking for any tremors, any weakness, anything like that. Okay, very good. I'm gonna do the same with your legs. So just kind of push down on my, okay, same on this side. Okay, and can you kind of put your legs out? Both, yeah, perfect. Okay, no tremors. And then relax your legs. I'm gonna lift your leg up. You just relax. Don't push against me. Just relax, and then I'm gonna. Okay, just checking for any hypotonia. Lift again. Okay, very good. Okay, so next what we're gonna do is we're going to check sensory function next. So to both superficial touch and pain. So I'm gonna have you close your eyes. I'm going to touch different areas on your extremities, and you're going to let me know whether I'm touching you on the left side, the right side, your arm, or your leg, okay?
Mm-hmm.
So your eyes are closed. Okay, very good.
Left arm. Right knee. Right foot. Left foot. Right leg. Right elbow.
Okay. You can keep your eyes closed. I'm just going to use a little bit of like a sharper object, but it shouldn't hurt. Just let me know if you feel where you feel that, okay?
Left arm. Right hand. Right leg. Right calf. Left foot.
Okay. Very good. All right, so what we're going to do next is we're going to test something called perception of position. So what I'm going to have you do again is close your eyes. I'm going to take your hand, and you're going to let me know. I'm going to just take one of your fingers, and you're going to let me know if I'm putting, like, your fingers going up or down, okay?
Okay. Up. Down. Up. Up still.
Okay, I'm going to try it on the other hand.
Up. Up. Down.
Okay, very good. Next, what I'm going to have you do is I'm going to have, close your eyes for me. I'm going to have you take an object into your hand, and you're going to tell me what you think that is.
It's a coin. Quarter, nickel, something like that.
Okay. Keep your eyes closed. And in the other hand, I'm going to have you do the same thing.
Paperclip.
Okay, very good. You can keep your eyes closed. Actually, I'm gonna write a number in your hand, and you're gonna let me know what number you think that I'm writing, okay?
Mm-hmm. Hang on, do it again. 9. You're writing in my perspective?
Yeah.
2?
Yeah. Let me see his
I
hand.
thought I was upside down.
Sorry.
8.
Okay, very good. Next, what we're going to do is a 2-point discrimination test. So what I'm going to have you do is I'm going to have, I keep having your eyes closed. I'm going to have give me your palm of your hand. And I'm going to, actually with the ball of your fingers, you're going to let me know if I'm touching you with 1 point or 2 points, okay?
Mm-hmm. 1. 1,
Hold on.
2, 1, 2,
Okay, let me see your other hand.
1, 2, 2, 1.
Okay, very good. Okay, and then what we're gonna do next is I'm gonna go ahead and I'm going to check your reflexes. So let's go ahead, we'll just start with your brachial. So just see your arms here. Okay, and then we'll do it on both sides. Okay, next I'm gonna just have your triceps reflex. So, oh, and I did your biceps first. So let me just relax your arm here. Okay, I'll do it on this side. Okay, and then we'll just going from one side to the next here. Your brachioradialis. Just feeling for the tendon here. And you're just, okay, very good. Okay, and if you can just scoot back a little bit in the bed, I'm gonna test your patellar tendon next. Just wanna make sure your feet are dangling, okay? It may be hard to see on the, okay. And then next I'm gonna do your Achilles. You can go ahead, just, I'm gonna flex your foot and then, oh no, I'm gonna do it. And then I'm gonna hit here and the normal response is to a plantar flex. Very good. I'm gonna make sure I get on there. Okay. And then also I'm gonna check one more reflex. I'm gonna do the abdominal reflex when we do the abdominal assessment, so I don't have you lying back down just yet. But what I'm gonna have you do is I'm gonna take your foot up and I'm just gonna run the bottom of my reflex hammer on the bottom of your foot and just, there we go. Okay. Get myself up here. Okay, perfect. And then what I'm gonna have you do next is I'm gonna have you stand up for me, and I'm just gonna test your gait. So you're just gonna walk straight ahead for me. And when you walk back, walk on your heels. And walk back to where you were on your tippy toes. Okay, and you can walk back to me regular. All right, so what I'm gonna have you do, just, you could stay standing, stand this way. I'm gonna have you close your eyes, put your arms forward, and I'm just doing something called a Romberg test. So, perfect, you have a negative Romberg test. You can open your eyes. If you would have lost your balance, then that would have shown a positive Romberg test. All right, so next what we're gonna do is we'll move on. That's the end of the neurological exam. So what I'm gonna do next is just, I'm evaluating your skin. I'm looking for any lumps, bumps, moles. Do you have any tattoos or piercings that I'm not able to see?
Mm-mm.
Okay, and you haven't noticed any new moles?
No.
Okay, your hygiene looks good. Your skin is warm, dry. Let me just look at your fingers and your hands. Your nails look good, no cracking, no peeling, no clubbing that I see. I'm just gonna check capillary refill while I'm here, and that's less than 3 seconds. And I'm gonna go down, feel your legs as well. Checking your capillary refill. Okay, very good. And I checked your nails. What I'm gonna do next is I'm gonna check for skin turgor underneath your clavicle, and that's good. It goes back down right away. Your cuticles were good. Your hair, let me just take a look here. I don't see any lice. I don't see any issues. You have good hygiene with your hair. While I'm here, I'm also gonna just feel for the shape of your head. I'm also looking for any missing hair patches, anything abnormal, which everything looks good. I'm just feeling for your sphenoid and your occiput, your processes over here, your mastoid, and feeling for any lumps, bumps, and it's easy because you have just gotten a haircut. Okay, so next what we're gonna do, so I didn't notice any lumps, bumps. I'm gonna just, when we did the cranial nerve 7, I checked your facial symmetry, but I'm just gonna take a look again, making sure everything is symmetrical. I'm also gonna feel for your temporal pulse, and then your sinuses. And let me know if you're feeling any pain or discomfort when I'm pressing on here. So, any pain or discomfort, your frontal,
no,
your ethmoid, your maxillary, and your sphenoid. Nothing?
No.
No problem at all? Okay.
No, that's alright.
Alright, very good. So next we're gonna move on to your eyes. So when we did the cranial nerve exam, I checked for abnormal eye movements. I also checked for just the way your eye's moving as well as your pupillary response. So I'm not gonna repeat that again. But what we are gonna do, let me just take a look visually. I'm checking for the sclera. I'm looking at the conjunctiva, just making sure that there's no drainage, no redness, no yellowing of the sclera. Everything looks normal. I'm gonna just check your vision with the Snellen chart. So what I'm gonna have you do is I'm gonna have you just read to me the bottom line. Can you read that?
Both eyes or one eye or?
With both.
LTFPH.
Okay, very good. What I am gonna do is check your peripheral vision. So I'm gonna come from both sides, and you just let me know when you see my fingers. Okay?
I could see him now.
Okay.
Well.
Tell me when.
Okay. Stop. Stop.
Okay. Okay, so then what we're gonna do is I'm gonna just try and visualize the back of your eyes. I'm visualizing for the macula, the fovea, and the arteries in the back. So I'm just gonna so what I'm gonna have you do is you're just gonna focus on an object straight ahead, because I am gonna have a bright light that's checking your eyes, and I don't want to blind you too bad. Okay, so I'm just checking for the red reflex. I'm just following. Sorry, I gotta get really close. Okay, so yeah, macula, fovea, and the renal arteries. Okay, I'm gonna do the same with the other eye, okay? Just touching here so that I make sure that I don't run into you. Okay, and I can visualize the back of your eye. Okay, very good. Okay, next what we're gonna do is we're gonna move on to the ears. I'm gonna go ahead and I'm just gonna do a tug test, which you just let me know if you're feeling any pain or pain at all when I tug. I just wanna do that before I start looking inside of your ears with Are you feeling any pain or anything?
No, it's okay.
Okay. Oh, sorry.
No, it's okay.
Okay. Very good. And then I'm also looking for any abnormalities, and then looking at the symmetry and the regularity of your ears, and everything looks good. I don't see anything. Visually on the outside, that is a problem. So let me go ahead and I'm going to take my otoscope here. Let me just change the head. And I'm going to just look inside the auditory canal, looking at the tympanic membrane. The handle is up. Okay, the tympanic membrane looks good. It's like a pearly gray color with no bulging that I see. Let's see the other side. very good. Same on that side. And I'm going to keep that on because I'm going to be checking your nose as well. So I'm just going to check the inside of your nose. Are you having any abnormal drainage or anything? Okay, and everything looks normal. I'm just going to check for any deviation in your septum, any abnormal drainage that I see inside, okay?
Mm-hmm.
Okay, and everything looks normal, no abnormalities there. I'm also going to check your mouth. I'm looking for I'm looking at your lips, checking for any cyanosis, any cracking, any peeling, any sores or redness that I see. Can you open your mouth for me and say ah? Okay, perfect. Yep, your uvula is midline. Everything looks normal. Teeth, palate, hard, soft palate, your tongue. We checked earlier for the symmetry. And then I would also check for a gag reflex, but we're not going to check for that now. Next, we're gonna move on to your neck. So I'm just gonna palpate for your trachea here, just making sure everything is midline. I'm also feeling for your thyroid gland. Can you swallow for me? Okay, just feeling for your thyroid. Everything feels normal. I'm also gonna listen for any bruise on your thyroid. And while I have my stethoscope, since I wasn't using it earlier, I'm going to listen for any bruise in your temporal and above your eyes as well, okay?
Mm-hmm.
I'm going to listen with both the bell and the diaphragm of my stethoscope, okay?
Mm-hmm.
Can you hold your breath for me?
Keep holding.
No, oh, you're good now. I'm sorry. You're breathing. Okay.
I'm breathing.
You don't have to hold your breath anymore. Okay. And also while I'm here, I'm just going to palpate your jaw for any crepitus. And can you like open and close your jaw for me? Okay. And I'm just feeling if you have any like TMJ. And I don't feel anything like that. So next I'm going to palpate your lymph nodes. Let me know if you're feeling any pain or tenderness, but I'm just feeling for any enlargement. So your tonsillar and submandibular, submental. Chin here. Can you turn your head, your cervical, like anterior cervical, turn the other way? Okay, and then you can look straight, your supraclavicular and your infraclavicular. Okay, and then everything else feels normal. Okay, I'm just gonna check the range of motion in your neck. So I'm just go up, down, left, right. Okay, perfect. The range of motion in your neck looks good. And I was able, and I'll listen for more bruise in your carotid artery as well when we do the peripheral vascular exam. So what we're gonna do next, actually, can I have you take off your shirt for me? We're gonna move on to the respiratory exam. I'm gonna move this out of the way here. You can stay seated. Get comfortable. No problem. So what I'm just doing is an inspection. I'm looking to see if you're using any accessory muscles while you're breathing, evaluating the rate and rhythm of your breath. I'm also checking for any abnormalities, any tripoding position, any issues with like your sternum, anything that I can see visually and you're not looking like you're working hard to breathe at all. I'm also, so I identified your trachea before, so I'm just gonna feel for your suprasternal notch and the angle of Louis. Also, while I'm here, evaluating your anterior posterior lateral diameter, which is normal. Very good. So next what I'm gonna do is I'm going to palpate for crepitus. So I'm just feeling that I feel any popping or cracking. And I'm going to do that on both the front and the back, okay? the side as well. I'll do. Can you lift this arm up for me? Thanks. And same on this side. Okay, so next what we're gonna do is something called tactile fremitus. So what I'm gonna have you do is every time I touch your chest, you're gonna say 99, and I'm just feeling for the vibrations, okay? Just relax.
Yeah. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, very good. All right, so then I'm gonna have you, I'm just gonna check for thoracic expansion, so you can turn that way for me. And everything felt normal. The vibrations were normal. I didn't hear any diminished sounds as well. That could indicate like a collapsed lung. So just go ahead and take a deep breath for me. And out. Okay, and that feels normal. So what we're gonna do next is I'm going to, while I'm here, I'm gonna have you stay right there. I'm gonna just grab my pen. I'm gonna check for something called diaphragmatic excursion. So what I'm gonna have you do is I'm going to percuss down your back, but what I'm gonna have you do first is you're gonna take a deep breath in and you're gonna exhale all the way, and I'm gonna percuss down your back. So take a deep breath in and exhale all the way. So I'm just feeling for it to go from a resonant to a dull sound, and I'm just gonna mark where I felt that change. Sorry, I have to mark a little bit on your back. And then what I'm gonna have you do next is I'm gonna have you just inhale very deep for me, like inhale all the way. And I'm gonna do the same thing until I hear that resonant to dull. And I'm gonna mark that. I'm just gonna measure it real quick here. Okay, and that's about 2. So, okay, perfect. And that's normal, and it should be anywhere from, oh, I'm sorry, let's use. I have the inches, so I don't know, I was like, that's not right. Okay. Okay, so yeah, 3.5 centimeters. Okay, so you can turn this way again. I'm gonna just do a regular percussion. I'm just feeling for the resonant sound. And I'm just gonna do that on the front and the back as well. Just lift your arm up, buddy. Check over here as well. Both sides, thank you. Okay, I'm gonna relax your arm. I'm also gonna just tap down your back, percuss down your back, and you're just gonna let me know if you feel any pain or discomfort. I'm just checking for the costovertebral areas, making sure there's no pain or discomfort there. That would indicate possible kidney pain. Anything?
No.
Okay. All right, and I'm gonna just go ahead and I'm gonna auscultate your lungs. I'm gonna just, every time my stethoscope touches you, just take a deep breath for me, okay? Let me know if you're feeling any shortness of breath, because I'm gonna do this on the front and the back. Okay. All right, very good. And then the last thing that we're gonna do for the respiratory exam is I'm gonna check for vocal resonance. So what I'm gonna do again is I'm gonna listen with my stethoscope, and every time I touch your chest, you're gonna say the letter E.
E, 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 E.
Okay, very good. If the E sounded like an A sound, then that would possibly indicate like a collapsed lung or something like that, but everything sounded normal. Okay, so what we're gonna do next is we're gonna move on to the peripheral vascular exam. I'm gonna have you lay down on the bed for me, and I'll just move the camera over. Should be. Okay. All right. So what I'm doing here is I'm just evaluating your peripheral, like your extremities. I'm looking. Like I checked earlier. For the warmth, the texture, the temperature, and everything like that. I'm just kind of taking a look. I'm also looking for any muscle atrophy that I notice. I'm looking for hair distribution. I'm looking for varicosities. I'm looking for any pulsations that I see visually. I'm also gonna just check your peripheral pulses while I'm here. I'm just gonna check making sure they're even. Brachial. I'm also going to check your femoral pulse as well. And when I do the abdominal assessment, I'm going to listen over there for any bruits that popliteal. Your posterior tibial. Your dorsal pedis. Okay. And everything like before feels nice and warm and dry. No, I also didn't notice any swelling or edema. And everything looks good. Hair distribution, especially you have good hair growth on your toes, which shows good circulation everywhere. And everything was even on both sides. So what we're gonna do next is we're gonna go ahead and I'm gonna go on to the cardiac exam. So I'm just gonna palpate your carotid pulse, just on each side. And then we're also gonna check for jugular venous pressure, but while I'm feeling for your carotid, I'm noting the rate, the amplitude of the beat. Let me listen real quickly for any bruits here with the belt and the diaphragm. Can you hold your breath? Take a breath, breathe normally, and hold your breath again. Okay, very good. And I didn't notice any bruits there. So checking for jugular venous pressure next. I'm gonna have you turn your head to the left for me. I'm just looking for your carotid or your jugular vein. I'm noting the pulsation, and I'm noting the highest point of pulsation. And what I'm gonna do is I'm going to measure. Let me grab my ruler. And I'm gonna measure the highest point of pulsation down to your sternal notch. Very good. All right. So as you're laying here, I'm also just seeing if I can see any thrills or heaves or lifts or anything without palpating first. I'm also, I look before any pulsations, anything like that, and then looking for any pectus excavatum, any abnormalities with your chest. anything like that. And I don't see any of that. So what we're gonna do next is I'm gonna palpate, and I'm gonna feel for any lifts, any heaves, any thrills. And you can just breathe normally, okay?
Yep.
So your aortic, pulmonic, ribs, point, and my jaw. I'm also feeling for the point of maximal impulse, which is at the apex of the heart. Sometimes it's a little harder to see, so I'm just gonna feel. I'm sorry. So I'm gonna have you turn to the left for me, like kind of roll over to the left, and what that does is that brings the point up a little bit more, so it's easier to feel. And I didn't feel any lifts, heaves, thrills, anything like that. So what I'm gonna do next is I'm gonna listen to your heart sounds. And I'm gonna listen with the bell and the diaphragm of my stethoscope. So I'm just you just breathe normally, okay?
Yep.
I'm listening for any murmurs, any abnormal heart sounds. Okay, very good. So what I'm gonna have you do next is I'm gonna have you sit up for me. I'm gonna listen again. I'm gonna scoot back a little bit. Okay. I'm gonna have you listen again, but what I'm gonna have you do is I'm gonna have you kind of lean forward a little bit, because that kind of brings, if I were to hear any murmurs, which I didn't hear any murmurs, any abnormal heart sounds, it's just a normal S1 and S2, no splitting. And I'm gonna have you hold your breath for me, okay? Okay, you could take a breath. Let me know when you're ready. I'm gonna have you hold your breath again. I'm just gonna listen to with the other side of my stethoscope. You're okay? Okay. Deep breath and lean forward. Okay, very good. Okay, so I didn't hear any murmurs, any abnormal heart sounds, anything like that. So that completes the cardiac assessment. We're gonna move on to the abdominal assessment next. So I'm gonna have you lay, you can just lay like at that 30-degree angle, that's fine. So I'm just inspecting your abdomen for anything abnormal that I see, any hernias, any masses, anything that I can visualize. I'm also looking at your abdominal aorta and seeing if there's any pulsations, any issues there. I'm also, can I have you just lift your neck up for me? Okay, and I'm just checking here to see if any hernias have come up, any separation of the abdominal muscles, and I don't see that. I was also looking at any stretch marks, any abnormalities with your abdomen, which I don't see. Next, we're gonna listen to all 4 quadrants of your abdomen. I should hear about 5 to 30 vowel sounds per quadrant. And just breathe normally. Okay, very good. Then what we're gonna do is, since I already have my stethoscope, let me just go ahead. I'm gonna listen for any bruits at your abdominal aorta, and I'm also gonna do the renal arteries as well as the iliac and the femoral. Okay. very good. And I didn't hear anything there. So next what I'm gonna do is I'm just gonna percuss your abdomen in all 4 quadrants. It should be like that tympanic sound, because if it was a dull sound, then that could mean like a masser, but any of your organs. Okay, next what we're gonna do is we're gonna percuss for liver borders. I'm just checking the size of your liver. So I'm gonna start from the bottom and go from a tympanic until I hear a dull sound. Okay, and then we'll just measure that. It's about 7 centimeters, which is normal. Anywhere from 6 to 12 is normal. I'm gonna do the same thing on the other side for your spleen. Usually we don't feel for the dullness with your spleen unless it's very enlarged. So, but we're gonna feel. All right, I'm gonna have you take a deep breath in, like hold your breath in. Hold your breath. Okay, and then kind of do the same thing, because what that does is it brings your spleen, like your diaphragm will push your spleen down, but still. Okay, very good. Breathe normally now. Next I'm gonna go ahead and just percuss for where the gastric bubble. Until I hear a tympanic sound. Okay. Alright, next what we're gonna do is I'm gonna do a light palpation first. Let me know if you're feeling any pain or tenderness when I palpate anywhere in your abdomen.
No, that's fine.
Okay. Okay. Next what we're gonna do then, I'm gonna do a deep palpation. Let me know if I'm gonna palpate for your spleen or your liver first. Just let me know if you feel any pain or tenderness at all. I have kind of gotta go deep in there. I'm sorry. I'm also sorry. You okay?
Mm-hmm.
Okay. And just take a deep breath in for me. And just kind of, sometimes it's easy. It's better to feel that way. There we go. Okay. And then we're gonna do the same over here for your spleen. And take a deep breath in. Okay. And I'm also palpating like your lower abdomen. Also when I palpate your upper right quadrant, feeling for your gallbladder, for your appendix here. No tenderness or anything. Right?
No, it's okay.
Okay. And your intestines down in your left lower quadrant. You're palpating yourself.
No, I just feeling something.
Sorry. Okay. Alright, so what we're gonna do, and then I feeling also at your abdominal aorta, feeling for any palpations or anything. Okay, I will do that. Okay, and then the last thing I'm gonna check for your abdominal reflex, since you're laying here and we didn't do it during the reflex exam since you're laying down. Alright, just normal. There, yes, that's a normal response to contraction. Okay, there you go. Alright, I'll move my reflex camera there. Okay, so we're gonna move on to the musculoskeletal part of the exam, so you can go ahead and sit up for me. And kind of face me. I'm just inspecting your muscles, your exoskeleton, anything like that. If I can see any abnormalities, looking for any skin folds over any joints that I notice. What we're gonna do is we're just gonna I'm gonna palpate all of your joints individually, and then I'm gonna check for your range of motion, checking for any redness, any tenderness, anything like that. So we'll go ahead and we'll start with your fingers. I'm just kind of palpating the joints. Any tenderness at all anywhere?
No.
Okay, I don't see any redness, any swelling, anything like that. Just do some little range of motion. It's like fingers around. Okay, next we're gonna do your wrists. Let me go ahead and palpate that. Any issues?
No.
Okay, and no redness, tenderness, anything like that. So just kind of range of motion, up and down, abduct, abduct. Okay, perfect. Next we're gonna go on to the elbows. Same thing, any issues, okay, I don't see any redness, swelling. Okay, kind of up and down. Okay, next we'll go on to your shoulders. Give you a little massage here. Okay, same, so kind of just like put your arm up and down, arms in circles. Kind of go like this, like feel for, like take your arm, feel for the other side, and same on that. Okay, perfect. Then we'll go ahead and do your neck. I checked range of motion neck earlier in the exam, but we're just kind of like, and I don't feel any swelling, any redness, and no tenderness or anything there as well, correct?
Mm-hmm.
Okay, and you move your head all the way around. So next what I'm gonna do is I'm gonna check your spine. So you just stand up for me. I'm gonna feel down your spine. Feeling for the curvature of the spine. So lean forward and touch your toes for me. As close as you can get. I'm also checking for the curvature of the spine here as well. Making sure that looks normal. And you can stand up and kind of like rock side to side, forward, backward. Okay, you turn. Okay, very good, perfect. Oh, you can stand up because I'm gonna have check your hips next. Okay, and just kind of do some range of motion for me as well there, like around, kind of kick forward and. Okay, and we'll do your knees next. No pain or tenderness anywhere there?
No pain.
Okay, no, I don't see any redness, any swelling. So go ahead, as again with your knees, just kind of up and down like a okay, you can let me do your ankles next. Feeling, and definitely no swelling, everything looks good there. And just kind of like roll your feet around, up and down, plantar, dorsal, abduct, adduct. Okay, very good. And same with your toes. No issues there. I don't see any swelling, any redness, any tenderness. Okay, and no nodules, and just kind of. Okay, and that should conclude our entire head to toe assessment. Do you have any questions for me, Mark?
No questions.
Okay, perfect. Thank you so much.
Thanks.